was noticing was a psychological dependence. So she said, excuse me, she said, I've come off it, my pain is, and I'm frightened. My pain is ramping up and I'm frightened. And this is absolutely classic habituation. So she's in this gray zone and she has a psychological dependence on, whoa, this drug, can I survive without it? She is not addicted, absolutely not addicted. That's right at the end of the scale. And the majority of other people who are on this type of medication, you may find that it's actually helping because it's quietening down your pain system. If you try and stop it and your pain system is still zoomy and is still sensitized, you may find your pain increases. And if you feel frightened, it's because you had that in the back of your mind, that psychological dependence on the medications, if the help that you were getting, but you're not addicted at all. So what I suggested was that what she does is restart, find the absolute minimum dose that will give her pain relief that's acceptable, to put her in a state where she can then do all the other work, which is really the key, the basis of our Life After Pain community, which is to work on mind, neuro-mind, mind-body practices to reprogram your sensitized pain system. As your pain system sensitization gets less and less and less, and there's so much evidence this is the way to go, then it may be that you can come off the Lyrica, reduce the dose further, and then as everything quietens down, as the process causing the pain quietens down, she may be able to come off it altogether, or may need to take a tiny dose, and it's not a big deal. So this is using medication for its true use, which is, it's a bit of a help. It's going to create things to be quiet, but I'm not dependent on it. And I'm just using it as part of a whole bigger strategy. And as my self-efficacy improves, as I get better at being able to move well, do the things I want to do, quieten down my thoughts and my beliefs about the pain, as I start to normalize everything, then my need for the use of that medication becomes less and less, and then I can just wean it off completely. That's gabapentin, pregabalin,